Hello, I'm Aisha, and I'm sitting here with Dr. Goldman of Georgia Hormones, his practice in Alpharetta, Georgia, where we'll be discussing some PCOS topics, all the treatments and latest research that he has to fill us in on. Thank you for sitting with us today. So your practice at Georgia Hormones, what does that include for our patients with PCOS?
Well, about what PCOS is in the first. Usually, women find out that there's something with their cycles fairly early on in their lives. They may be having irregular periods. They may be skipping periods. They could even have occasionally heavier periods. If later on that individual is trying to get pregnant, they might find that despite the fact that they're having sex on a regular basis, that the pregnancy doesn't occur. So in that case, PCOS might be, there's really two separate, one of them is an inborn control mechanism in what's controlling the periods, and the second one actually is a woman that has a tendency toward physiologic causes for polycystic ovary. IGF is similar in structure to insulin. So at the beginning of her cycle, the brain is telling the ovaries to start to make hormones. And when the theca cells in the ovary get this message, they are actually stimulated by other cells in the ovary making insulin-like growth factor that is stimulating these male hormone-producing cells to make the male hormones. And then those male hormones.
Wow.
So if that individual
big transition process.
Yes.
To say who has the facial hair and who has acne and help that?
That's not so much in foods except for lowering the amount of sugar, basically. So as far as the body is concerned, bread, potatoes, they are all turned into sugar. So white bread is basically the same as drinking Coca-Cola as far as the body's concerned.
Wow.
Some carbohydrates are much harder to break down. Oatmeal would be somewhat slower than eating a piece of white bread. But interestingly, you can have different women which even have the same blood male hormone levels, and depending upon their genetics, their faces, the skin on their face and the hair follicles on their face may be more sensitive to the male hormones or less sensitive. So some women at the same testosterone level may get acne and facial hair, and other women won't. There are some drugs that can block the male hormones from getting to that area, so that can help relieve the facial hair. But usually the two things that we're trying to do is either, number one, getting the pre-diabetic patient to change her diet. If she really reduces the amount of carbohydrates that she has coming in, then she'll have less insulin, and that's really solving the problem on the front end. Part of this research has really been driven by companies that make diabetes drugs, which also lower insulin levels. But the diabetes side effects to the patients. So
because they're only covering that one aspect of diabetes.
Right. So really I'm trying to solve the problem, and if I can get the patient to change her dietary habits. One of the interesting things about diabetes in America just in general, though, is we've only been drinking huge amounts of Coca-Cola and some of the other sugary stuff. It really got much worse in 1981. That was the year that Coke and Pepsi changed from using cane sugar to using high fructose corn syrup. And they did that because it was much cheaper. And the high fructose corn syrup stimulates insulin rise much more so than cane sugar does. So that only made the diabetic problem worse. But over the generations, because of epigenetics, 1 or 2 generations from now, we as a species might learn to tolerate the higher sugar levels. Our genes will not change, but the epigenetic programming is going to change. So people that are predicting that everybody in America is going to be diabetic by, 2100, I think they're going to be proved wrong, because the real problem was in the 1930s, America was really undernourished during the Great Depression. And so they were programming their children to really hold on to the calories. There is a second kind of polycystic ovary syndrome, though.
Wow.
There are women whose mothers may have had high levels of male hormones during the pregnancy.
So it would be hereditary?
And a male brain is mostly making a ovary-stimulating hormone called LH, whereas a normal female brain is stimulating the ovaries to make mostly estrogen at the beginning of the cycle, and the male hormones only at the end of the cycle. And the theory is that some of the women, when they were a fetus inside their mother, if their mother had high levels of male hormones, they may have been programmed to have a male-type stimulating pattern. And so they're actually stimulating their ovaries to make male hormones more so, and not so much to have the normal cycle. The difference if a 17-year-old girl was coming into my office, the 17-year-old with the pituitary gland problem may be 17 and 112 pounds, and the 17-year-old girl with the prediabetes problem may be 17 and 212 pounds.
Oh, wow.
So they're pretty easy to tell apart at the age of 17.
Yeah.
The most diabetic people in the United States right now are the Indians of the Southwest United States. The Native Americans that are living in Arizona and New Mexico. It's a desert. They, for generations, were living on very small amounts of food. And their bodies, therefore, epigenetically, are programmed to save every calorie.
From blood pressure to what tweaks needed to be taken out?
That drug actually was based on a hormone called aldosterone. And it is shaped in such a way that it's kind of a cross between aldosterone, which is a blood pressure control hormone, and testosterone. And it just happens to fit on that testosterone receptor.
With, teenagers and individuals that are, less educated than a 50-year-old woman or something like that, what could you tell them, if they just found out about their diagnosis of PCOS? What would be the most common reassurance that you could tell them as a doctor?
Well, I'll tell you one big thing that's happened between when I started medical school 40 years ago and now is that the medical school library, you had to be a medical student or a doctor on staff or something to be able to get in. Now we have the internet. So although there is junk information on the internet also, the existence of the internet has hugely changed the relationship between patients and doctors, because patients can come into the doctor and be very well informed.
Thank you for having.
All righty.
Thank you.
And good luck with your endeavors.
Thank you. Thank you. Hi, guys. Thank you for uniquelyaisha.com. We just finished our interview with Dr. Goldman in Alpharetta, Georgia. Please stay tuned. There'll be more to come.